The last thing I want to mention, it's not incontinence, it's erectile dysfunction, okay? Because a lot of the muscles we've talked about, like I said earlier, have a part to play in this as well, okay? Erectile dysfunction is the most commonly reported problem following prostatectomy, okay? And the pelvic floor exercises that we've talked about today have a role in dealing with this problem as well, okay? It's a little bit of an aside, but I think it's important to mention it. Some studies say that it's as high as 88% of men report erectile dysfunction. For a lot of these men, it resolves very quickly, and for some men, it lasts a long time. So it depends on the person. But in studies where they have done these pelvic floor exercises, the muscle force in the pelvic floor has been increased in 87% of men. So a really high percentage of men respond to these exercises, and it improves disimproves their erectile dysfunction. Okay, so it can help with that as well. So if you think, actually, I'm lucky, the incontinence issues have been minimal, but this is something that you're worried about, the pelvic floor exercises have a place for this as well. Okay?
Very good.
This book, and I have it there, okay? This book is something that I would advise any man who's getting prostatectomy, or really prostate surgery, because sometimes, you know, you have other conditions with the prostate that call for surgery. I would advise them to get this book. The information I've given to you today is in the book. So this presentation covers it. If you want to do some reading yourself, just to be aware that that is a resource. Craig Allingham is a leader in this field, and he's Australian. And it just doesn't have a lot of attention maybe in Ireland at the moment. So if you want a resource that you can read yourself by an associate professor, so it's all done with the best research in mind, this is a good resource to have. He does advise that you start these exercises 6 weeks before your surgery. And that's the optimum time to start them, and then the recovery after surgery will be less. So to start these exercises over the next few weeks will increase your recovery time after the surgery, and he brings all of his patients in 6 weeks before they're up to start these. And that's an ideal world. He sees most of his patients after the catheter comes.